And you are welcome to my next class. So we'll be discussing about lactic acidosis as one of the metabolism, carbohydrate metabolism disorder. So lactic acidosis. Lactic acidosis refers to lactic acid buildup in the bloodstream. Lactic acid is produced when oxygen levels become low in cells within the areas of the body where metabolism takes place, or in response to sympathetic activity related to epinephrine type substances or exercise. So when there are some conditions in the body whereby there is a low oxygen, where the body requires energy or requires oxygen, maybe in situations maybe whereby somebody is tense, for example, like when there's a problem, for example, there's a problem, and you see the body will react in an hyperactive manner. So in that situation, in exercise state where there's lack of oxygen, you see the body converting lactic acid, converting lactic, the way you see the body making use of lactic acid. So there will not be build up of lactic acid in the bloodstream in order for the body to have enough energy to do work, like when one is doing exercise. The next one we're going to be looking at is glycogen storage disease. What is glycogen storage disease, if you may ask? So glycogen storage diseases are a group of rare conditions in which your body can't use or store glycogen properly. Of course, you know that when there's excess carbohydrate or when there's excess glucose in the body stores it as glycogen in the liver. Now, in this disease or this condition, the body cannot use or store glycogen properly. There are types of inherited metabolic disorders. This glycogen storage disease can be inherited. So glycogen is the stored form of glucose. Glucose is your body's main source of energy. It comes from carbohydrates, a macronutrient in certain foods and fluids you consume. Now, when your body doesn't immediately need glucose for energy, it stores glucose primarily in your skeletal muscles and liver as glycogen for later use. Now, your body creates glycogen from glucose through a process called glycogenesis. We have discussed this before. When your body needs extra fuel, it breaks down glycogen for use through a process called glycogenolysis. Several enzymes are responsible for these two processes. That's both glycogenesis and glycogenolysis. Okay, so let's continue with our lectures. Now, glycogen storage disease happens when you don't have one or more of these enzymes. That's the enzymes responsible for glycogenesis and glycogenolysis. Your body can't use stored glycogen for energy or maintain steady blood glucose levels. This can cause several issues, including frequent symptomatic low blood sugar, which is known as hypoglycemia, liver damage, and muscle weakness. We have types of glycogen storage diseases. Your body uses many different enzymes to process glycogen, so there are several types of glycogen storage diseases. So researchers know more about some types than others. Yes. So glycogen storage disease mostly affects your liver and muscles. Some types cause problems in other areas of your body as well. So we'll look at some of the types we have here. In fact, there are so many. I'll just mention just a few. So we have one of the type here we call type OA. The enzyme deficient is glycogen synthase 2. And it is known as Lewis disease. The main area of the body that is affected is the liver. So we'll look at the second one here, type OB, known as muscle glycogen synthase. Muscle glycogen synthase, that's the enzyme that is deficient. And the name of disease is Lewis disease. Then it majorly affects the skeletal and cardiac muscles. We also have von Gecker's disease, Pompe disease, etc. There are so many of them. But now, how common is glycogen storage disease? Glycogen storage disease is rare. It's not a common one. Glycogen storage disease type 1, which is the von Gehr's disease, the most common type, occurs in approximately 1 in 100,000 births. So how is it diagnosed? To diagnose glycogen storage disease, your child's healthcare provider will likely recommend several tests. So tests like the fasting blood sugar test, the basic metabolic panel, lipid panel, liver function test, urinalysis, abdominal ultrasound, genetic testing. What are the symptoms of these glycogen storage diseases? 1. Muscle cramps or muscle weakness, slowed growth and poor weight gain in children, enlarged liver, hepatomegaly, low muscle tone, and high cholesterol. Okay. So how the diagnosis and the test, how do healthcare providers diagnose insulinoma? Because insulinoma is one of the several pancreatic neuroendocrine tumors or islet cells tumors. These are rare tumors that start in your pancreas endocrine cells. They affect the endocrine cell that releases insulin, the hormone that keeps your blood sugar level from getting too high. So how is this insulinoma? How is it diagnosed? It is diagnosed through several tests, starting with a physical exam and medical history. They will also ask about your specific symptoms. If your symptoms come and go, how long you have had the symptoms, and if the symptoms are getting worse. If you're having symptoms, now your healthcare provider will also ask you to do blood glucose tests. Okay, so what other tests can they use to diagnose insulinoma? Your healthcare provider will probably do one or more of the following imaging tests also. So we're going to be leaving that. That is not the area that we are so much interested in. So in our next class, we'll be looking at fasting plasma glucose, capital letter FPG. See you in my next class.